Okay, now my watch is telling me to breathe.
You forgot?
Forgot to breathe.
What would you do? Without your Apple Watch?
I'd go for the Habs. We're going to talk about, you noticed the Habs jersey? I know. Haha. I decided to wear the Habs jersey. They're going to win tonight. They're going to win every night. Well, I wanted to go to 7 games. I already talked about that. Did you see the video before? Because we talked about all the injuries that aren't going to happen and the Habs are going to win. So now it's Habs week. Nothing matters. So I don't care that we're talking about a baseball injury, right? Right. Okay. So Mike Soroka. Achilles injury. Not one, not two, 3 Achilles injuries to the same foot. What happened? Well, first injury, boom, impact, went in, tore it, popped, had surgery, had a revision surgery. And then he's getting out of his boot, pop, it pops again. What happened? Now he's going to Cleveland Clinic to see foot and ankle expert. And let's see what happens. He's out. He's out for the season. Why do you need your Achilles? Let's look at this. There's the calcaneal tuberosity. Calcaneus is your heel bone, okay? It has a weird shape, all right? It's got a posterior element. It's got an anterior talar dome, anterior process. It's got essentially significant elements that make it this strange shape. It's elevated and comes down. Okay, it's got an angle, and it's got the biggest tendon insertion that it has is the Achilles tendon. And what does it do? So Achilles tendon applies here. And if you go back to my other videos, you'll see plenty. I think that we have at least a couple of other Achilles injuries that I've talked about. But the Achilles tendon is here, and it pulls the calcaneus. Now, why does it pull the calcaneus? Well, if you pull the calcaneus, I have to break this to move it. So if you pull the calcaneus, it does this. Yeah, those were my sound effects. Because it's Habs week. And it doesn't matter that I have the worst sound effects because it's Habs week. Yeah, go Habs. So, I'm laughing at my own jokes. I love it. I don't care because it's Habs week. Don't you love the negative comments down below? It's like, what does he know? He doesn't know anything. What is he talking about? Yeah, okay. I don't know anything. Right. Sure. Whatever you want to say, Mr. YouTuber that comments and doesn't actually have his own YouTube video. What do you know? Why don't you put your YouTube video and your analysis of the Habs winning against the Tampa Bay Lightning? Let's see your prediction. Because I predict sunny skies. Can skies be sunny? I don't care, because it's Habs week. What am I talking about? Achilles. Let's get back to the real story. So, which is Habs week. But it's Achilles tendon for a baseball player during Habs week. Because I don't care. It's Habs week. Okay, enough of that. So Achilles tendon. And when it ruptures right near the insertion. And oftentimes there's this watershed area of a couple of centimeters, a few centimeters, a couple of centimeters, depends on the size, depends on the overall vascularity. But essentially there's an area where there's less blood supply, where it inserts onto the bone. And in that area, you can get a rupture. So there's always usually some Achilles on the insertion side where it ruptures off musculotendinous junction or within the tendon substance itself. Now, when it ruptures, there's multiple ways to do the surgery. I haven't gone through, I don't have his medical records to see what type of surgery he had. Traditionally, there's 2 ways, non-surgical and surgical. Higher re-rupture rate in athletes with non-surgical. So for the most part, athletes get a surgical approach. Wait, doctor, but what kind of surgery options are there? Good question. I'm glad you asked. Because you can do open, mini-open, percutaneous. And there's lots of different ways, advantages, disadvantages, many different options. What do? I do a traditional open repair with sutures, bring it together, make a good knot, repair the peritoneum, which is a flimsy little tissue envelope that's fascial over the Achilles tendon to allow it to glide. The belief being that if the tendon glides, there's less tissue adherence, it doesn't tether to the skin and subcutaneous tissue, less scar, allows improved gliding, rehabilitation, motion. But everyone does things differently. If you're going to open it, might as well repair the peritoneum and the tendon. If you're going to do a percutaneous, you're not opening it all up. So the argument is that, hey, there's less tissue damage, you're bringing the tendon edges together, and you're passing sutures percutaneously, and that allows you to have a repair. And there's different devices and techniques to do it percutaneously. I don't do it percutaneously. I like to see the tendon, get it together, healed. That's my approach. There's lots of different approaches, arguments, evidence-based decision making. There's no clear evidence that one particular procedure is significantly better in terms of long-term outcomes than any other procedure. And so even, for example, in the case of non-surgical versus surgical, higher re-rupture rate in the non-surgical, but in terms of time to weight bear and healing is similar enough, whether it's a couple of weeks here and there. Long-term outcomes other than the re-rupture rate are similar in terms of power and strength. So it can be done. But if you're a high-performing athlete, even in a sport like baseball, did I say that? Yeah, I said that. So even in baseball, I'm going to get so many people that love baseball. Yeah, I'm going to get some comment, go back to Canada, or someone saying something else, go home. Go back to the Habs. There's always going to be a couple of characters that say that. But hey, it's all good. We're a loving country. And we love all sports, including baseball, which I guess is a sport, and like hockey. Like fishing. Yeah, baseball and fishing.
And bowling.
And yeah. Well, wait. Is bowling a sport? Yes. Anything is a sport. See, the challenge is when you're watching the Olympic trials, which I don't know if any of you are watching, I mean, these are ridiculous athletes. Like, I watched the women's 400 and 200 meter runs, the hurdles, and the 100 meter. It is unbelievable. I mean, their fitness level is so extreme. And then when you see a baseball pitcher with a paunch throwing a ball, it's like, come on.
That's an athlete?
That's an athlete?
And then you see like Simone Biles, and then you see CC Sabathia. Like,
oh, right, yeah. I mean, and then you see someone like Katie Ledecky, just boom. I like to swim. And so I have a lot of respect for someone that can be that far ahead of everyone else. It is unbelievable. And I run. Like to run. Don't run as much as I do. Yeah, I've got a bit of a belly. That's why I'm wearing the Habs jersey. See, you can't see my belly. I could be super fit. I could be an Olympic athlete under this Habs jersey because that's how it makes me feel.
But would you compete for Canada or the U.S.?
Yeah, well, actually, I am actually a Canadian citizen.
So you could go either way?
I could go. Well,
whatever team you make, you can get.
It's kind of like your home team. Ultimately, if it came down to it, I want to see Canada versus U.S. in the hockey, but I admit I would root for Canada. Was I talking about Achilles or the Habs?
Both.
Both, right. Okay. So basically, this is going to be his third surgery. Now, that's a big deal. So season ending, absolutely. Now, what happens now? So you have surgery once. Typically, the ends of the Achilles are very friable. And so I wonder what this looks like without the sound. Like, people are probably looking at this, and if they don't have the sound on, they're like, what the hell is he doing? Yeah. Here's the church. There's the steeple. open the door, and there's all the people, all Habs fans. So I just did that with my kids the other day. They loved it. So anyway, so third surgery. And this is going to be a challenging operation and recovery. One, he's certainly got apprehension. He has never had a chance to fully recover from his original injury. He's going to have stiffness. He's going to have bone joint alterations in overall collagen, bone metabolism, and everything, because he hasn't been weight bearing like he used to. His bone health is down, so he should have a bone and joint health specialist, probably get a functional medicine specialist, have nutritional assessment. I mean, these are high performing athletes. They're going to have all of these people around, just like everyone else should with these joint injuries. But in the current insurance state, that doesn't happen because the insurance companies feel like practicing without a medical license, and they make decisions rather than allowing patients and physicians to make these decisions for them and determine their optimized level of care. And instead, they have policies that determine benefits, which is sort of a backwards way of thinking at healthcare, but that's the way it is. But this is the healthcare system we're in. However, there are advantages and disadvantages. We don't need to talk about Canadian healthcare, but people wait for a long time sometimes for MRI and care in Canadian or UK health system, whereas we can get care earlier and sooner. However, there's a cost differential involved. So every health system has advantages and disadvantages. As an athlete, he's going to Cleveland Clinic. He's going to have top level care, no question about it. I don't personally know the foot and ankle surgeon that he's seeing, but it's going to be by a leading expert in the field at Cleveland Clinic. So if he's going to get a good opinion and quality outcomes opportunity, then he's in good hands. So what happens? So the original collagen fibers and tendon fibers are all like spaghetti. You stitch them back together, you recreate the tendon, but then it ruptures again. When it ruptures again, you have poorer quality tendon and collagen. So then the ability to suture is more challenging. And every time you have an operation, you technically lose quality tissue. So then the question is, does he need allograft or autograft? I would assume he's going to get an allograft if he needs it, if there's a defect, if there is poor fibrous tissue. Because if you don't have good quality collagen and it's just fibrous tissue, you got to take out that fibrous tissue and you have to replace it with some type of augment or allograft or collagen matrix. And you may also consider doing some type of regenerative technology. Now, maybe he didn't have that before, maybe he had it at his second operation, maybe he didn't have that. I mean, it's certainly an opportunity to consider some type of regenerative technology at this stage. And then, your calcium, vitamin D, turmeric, joint, bone health, bone broth, all of those other things that people used to think were all voodoo. In fact, there's evidence suggesting that yogurt, turmeric, calcium, vitamin D, bone broth, all of these things are good for joint health. I make those recommendations to my patients. Do it naturally or take a pill. Pills are more expensive, natural foods are healthier, and so it all comes down to balance. Exercise is mostly free. You can go out and do exercise and get fit, or you can take a weight loss pill and follow some program that's online to make you lose weight and get fit. In the end, it's a cost differential. What are you willing to do within the confines? And if you don't have the willpower, then yeah, absolutely. It helps having someone coach you, mentor you, train you, and that's perfectly fine. But it's always important to provide a balance of evidence, benefit versus risk and opportunity. And sometimes the counseling needs to be not just education, nutrition, but also mental health, because it's challenging. You get an injury, you're frustrated, you come back, you get an injury again. You try and come back again, and now you've got apprehension plus anxiety plus a career that has affected you. I mean, you are a professional athlete, and his career is being affected by this. And to some extent, maybe it's not his fault. Oftentimes it could be related to the genes, the type of collagen. He probably needs to have a metabolic endocrine full assessment. Could he have a collagen vascular disease? Could he have something else going on? And I'm not saying he does. All I'm saying is when you have multiple ruptures, it's always important to rule out the rare and wonderful things that show up in textbooks because they're rare in someone who's having multiple operations and surgery. But to simplify it, third operation, further recovery. His Achilles is at risk of shortening. His proprioception is going to be off and needs recovery. He needs to rehab. His overall bone quality is more than likely reduced. I'm not even going to say more than likely. I feel confident enough that when you have reduced weight bearing and reduced stress from a tendon pulling on a bone, that the bone quality in terms of strength, stiffness, elasticity, compressive, torsion, strength, and overall work, which is the area under the curve, and is reduced after multiple injuries. I feel confident saying that because the data speaks for itself. I don't know what the exact number is on Soroka, but it's going to be reduced. And for someone like him, reduced bone strength, elasticity, modulus of stiffness, and overall bone quality characteristics and bone material quality and characteristics may actually be normal for someone like me. But for him, who's a high-performing athlete, they're going to be not what he's used to and not what was his normal paradigm of health for him when he was at his top performing level. So there's a lot of different factors. I mean, certainly if someone comes like that, comes with a third injury, you get everyone. Get the endocrinologist, get the rheumatologist, get the genetic expert, find out if there's anything else that's going on. Because if it's collagen that's just stretching out and tearing, is it a collagen problem, and is there something else you need to do? Because this is important for them. I need my Achilles because I have to stand and do surgery and I have to walk around and see patients. But worst come to worst, if I had a career-ending Achilles injury and I could not play a sport recreationally, I could still do my work. There are workarounds for me. But for a super high-end athlete, those workarounds are just not there. So let's hoping you have a full recovery, high-quality surgery, and excellent outcomes. Go Soroka, go Habs.